Hi, I'm going to show you how to set up the pump for a thrombolysis. If you are doing a one-sided thrombolysis, you'll need 2 channels. If you're going to do it for bilateral legs, you'll need 4 channels. First, what you do is turn the system on. Also, for these thrombolysises, you want to use the tubing for the nitroglycerin, because the tubing for the nitroglycerin does not have any claves in it. The claves can cause bubbles, and you want to make sure there are no bubbles in the lines for thrombolysis. It's going to ask you if it's a new patient. You can say yes, and then just press confirm here. You don't need to do a patient ID entry. Press confirm. We're going to set up right now the cath sheath heparin. So you'll press the A, and you'll go to guardrails IV fluids, and you're going to look for heparin. And go to heparin for sheath. Heparin for sheath was selected. Is this correct? Press yes. The rate is per your provider's orders. Usually it's about 30 cc's an hour. Your volume to be infused, I usually put 450. Make sure there are no bubbles in the line, and make sure your chamber is full of the fluid, so as not to have any bubbles. And you'll press start. Next, you need to set up for the alteplase. So you'll hit this one. You'll go to guardrails drugs, and then you're going to look for alteplase. So we're already at A. Just page down a couple times, and there'll be alteplase here. You're going to press that, and then there's different categories: one for IR/OR, one for pulmonary embolism, and one for frostbite. We're always going to use the one for IR/OR. You'll click that. There are 2 concentrations that you can use: 10 milligrams and 250, or 10 milligrams and 500. We normally do 10 milligrams and 500, so you would click that. And then it'll ask, this was selected, is it correct? Press yes. This is for catheter-directed thrombolysis. You just want to confirm this. Make sure the selection matches the intended use. Press confirm. So 10 and 500 per hour. We're going to dose milligrams per hour. Press next. If you are doing one side, they usually do 1 milligram an hour. If you're doing bilateral, it's usually 0.5 milligrams an hour in each extremity. So we're going to press the dose, and we're going to have one-sided, so we're going to press 1 milligram per hour. Volume to be infused, I usually put 450 so the bag doesn't go dry. And then you'll press start. And that is how you set up the pumps for thrombolysis with the Alaris pump. Thanks for watching. Bye.